think we're here today to try and inform as many veterans as we can. We're here with Dr. Bash.
Welcome, Radio Land, TV Land, and YouTube viewers and listeners. This is Dr. Craig Bash. I've been doing veterans medical opinions for 30 years, and I have dozens and dozens of these radio shows which we're going to publish on this YouTube channel, and number 1 through whatever. So thank you for listening, and here we go.
We have a special guest speaker. It's Dr. Craig Bash. And Dr. Bash has got a sidekick, and I guess his name is Bill Creager. And Bill's been a VA person for a long time. So I want to get the show started. How you doing today, Dr. Bash?
I'm good. You guys got any topics you want to talk about?
And we can run down your, we can keep on the Bash bulletins, or we can actually, we can venture off and get some good advice on how to effectively file your claim so that the person who works at the VA can make it easier to adjudicate. Is that a good possibility?
Yeah, let's take a look. We got Bill Creager here. Bill, you want to tell me a little bit of your background?
Well, sure. I was a Marine for a few years, to say the least.
Yeah.
And then began helping vets with their claims as a certified service officer for the Marine Corps League. And from there, I went with the state of Maryland and to Paralyzed Veterans of America. Started representing claims and monitoring health care in the hospitals and representing appeals at the Board of Veterans Appeals, and got to admitted to practice in the Veterans Court. And then I took an opportunity with the VA itself as a decision review officer, what is now called Appeals Resource Center in Washington, D.C., and retired just a few months ago. Known Dr. Bash a long time. We've worked well in the past, and looking forward to helping him out with some of the cases that come to his attention.
So one of the things you taught me a long time ago is you said, always try and make the case easy for the raider. You want to try and talk about that a little bit?
Well, sure. I think if we start, if we think about what VA requires of those raiders, we can understand how to get our cases favorably resolved and the easiest way possible. And I think one of the most important things is the evidence. I found over the years that vets think they have a pretty good claim, but they don't fully understand that you've got to have, in many cases, some sort of medical evidence to back up what you're saying. Now, if we present those kinds of evidence, and VA rules changed over the years to allow private physicians to fill out those kinds of forms and express their opinions on topics, and now we can front load a claim with all the evidence and argument necessary, and VA has initiated a project to accelerate those claims. And I think it's in everyone's interest to make certain they get the proper advice and get the proper evidence and submit it all to begin with, so you don't ever find your way into that appeal process, which takes so very long.
Would that be the fully developed claim?
Yes. That's exactly what I had in mind. And I can say that it works because it happened to me. They actually granted my claim for increase and started paying me within 1 month from when I filed the claim. And I was pleasantly surprised.
Real.
Yes, it works. It works. Now that must be through. Pardon?
Oh, Bill, you've only been doing it for 40 years, so you got it right? 1 month.
Yes.
But so yeah, Bill. So Bill's been doing this for a long time and knows kind of what the different rules are. But in your case, Bill, you got good medical opinions, good evidence, right?
Yes. This particular claim, I was service connected for my ankle, and I went in and had an ankle replacement surgery. A metal joint with a plastic disc in it and things like that, which gives you a temporary 100% for a period of 1 year. And what I did was to assemble all my private records of care, reference my VA care, and submit that claim through my representative. And it was so straightforward and simple that the claim was processed extraordinarily quickly.
Oh, that's good.
Yes, and we can, veterans can do that if they get the help from a accredited representative, submit it with through that representative, and have all the evidence necessary for VA to decide the claim. And I've always practiced that way when I was presenting claims to VA. I always knew what the rater needed in order to grant the claim and gave it to them right up front.
Well, unfortunately, not enough veterans get started off on the right foot. Being able to supply that, first of all, they're not knowledgeable, and they're some of them are actually misinformed, and that's where they get in trouble, and that's how these claims drag on for years and years, because once they start denying them, it kind of puts a stigma on the claim, I believe. They take extra looks at it, and they seem to want more additional evidence than what you have in your possession.
You're right, Jay.
Hey, Bill,
You're right. Yeah, Doc?
Hey, Bill, how does it work? Like if a claim gets denied, like he was just talking about, and it goes back and gets granted later, does that show up as an error on the rater? Is that part of why they don't want to change them, or how does that work?
No, that's not. A different opinion in the future does not. In fact, raters would rarely ever know the outcome of an appeal. If an appeal goes to Washington, typically the majority would be remanded by the Board of Veterans' Appeals for further development of the evidence and re-adjudication. It would not go back to that original office in most cases. It would go to the Appeals Resource Center, where it would be revisited. And so the original decision maker would not be involved and would likely not know what the subsequent outcome was.
What if it's a CUE, like a clear unmistakable error? Does that go back to the rater, or is that not an error either?
No, a claim for clear and unmistakable error is a new claim. And upon receipt, it's adjudicated by typically someone who was not previously involved.
That's interesting.
Makes a lot of sense, though, to do it that way.
Well, it does make sense, and that's why you keep running into the same problems. I got a judge. I've had this judge for 15 years, and she keeps remanding the claim back for further development, but nothing ever gets done to it. and they sat on it 2 or 3 years,
understood.
and then send it back up to the judge. Now that's been going on
Yes,
for years. So, you know, that
Yes,
would
I've
work
seen many
wonderful
cases
if they would change judges out. You know, get a judge that could read and maybe understand what
I
they're doing.
understand. Yeah, I understand. Someone new and therefore impartial. There was a very interesting case decades ago that resulted in some changes at the regional office level because of that. The judge in that case, I think the name was Semenchuk, and he came into VA and was denied, and he initiated an appeal and he asked for a hearing. And he had a hearing at the regional office with the same people who denied him in the first place. And he filed suit, and he argued that his constitutional right was to have his case reviewed by someone not previously involved and therefore impartial. And as a result, the VA initiated what was originally called the Hearing Officer Program, and then that evolved and became the position of Decision Review Officer that we have today.
But they didn't change. Maybe in that particular case, they might have changed the judges, but not in all cases they don't.
Well, let me explain that we're not speaking of the judges at the Board of Veterans Appeals. We're speaking at the regional office level. And so the original raters who decide the claim would not then be involved with the appeal. It would be done by a decision review officer in some cases when you ask for hearing. The Board of Veterans Appeals was not affected by that particular case.
Okay, I understand what you're saying. They're actually two different entities.
Yes.
Now, what is the authoritative level of a DRO? I mean, do they have the capacity to make a complete new decision with no backlash, or how does that work?
Yes. When an appeal is made to the decision review officer, they review and they make a new decision, and that is defined in regulation. I can probably call that up on my computer here shortly, if you bear with me. But the decision review officer is empowered to grant the appeal at that moment, is empowered to order additional development if that was deficient, is empowered to find that a prior decision was clear and unmistakable error. And so there is a rather broad general authority given to the decision review officers.
So in a lot of cases I see the veteran, has a claim for some disability, but his symptoms match up with a different disability. And so the DRO can't really change the diagnosis in that case. He needs to just get a new medical opinion and try and clarify the diagnosis, right?
That's correct. A decision review officer, just like raters and Board of Veterans Appeals judges, may not use their own opinions to resolve medical questions. They must point to independent medical evidence in the file to support their conclusions.
So the case where the diagnosis is incorrect that's a big problem. I think that's probably where the veterans get off on the wrong foot a lot of times, because they don't really know medicine well enough to know exactly what to claim as far as it matched up with their symptoms,
True. Like for an example, some veterans who might feel like they've suffered some emotional trauma in service and may now have post-traumatic stress disorder as a result of that, they would not have the requisite training and knowledge in medicine and psychiatry to be able to diagnose themselves. And so the veteran may claim post-traumatic stress disorder, but in fact, the veteran may suffer from a different kind of an anxiety disorder or depression or some other diagnosis. The adjudicator, that is the decision review officer, the rater, the DVA judge, they must point to what the medical experts provide in the way of a diagnosis. And I've seen innumerable cases where the veteran says, I am not suffering with that diagnosis that the VA examiner says I have. I suffer with PTSD. Well, that kind of argument must be substantiated by a competent medical source, meaning someone trained and experienced in medicine, in order to provide the alternative diagnosis and explain why the prior diagnosis may not have been correct.
So in other words, they need to go see perhaps an outside psychiatrist.
It would not necessarily have to be outside. In fact, I have adjudicated cases where I resolve a difference of opinion between two VA physicians, where one presents me with one opinion and another presents me with an opposing opinion, and then as the decision review officer, I would then be required and permitted to choose which one of those doctors I side with.
So how do you resolve the issue of two opinions, like one from a nurse practitioner or a PA and one from a physician? What's your philosophy on that, or how did you do that?
Well, VA actually has guidance on that in the adjudications manual, M21, and it provides guidance on how to weigh the value of the evidence. Credentials, the degree of expertise of the opining expert, that's one of the criteria that are identified as relevant for consideration. The reasoning offered is often very crucial. Like, if one doctor says this is related to service and gives no explanation, but another says it's not related to service and provides a very persuasive narrative to explain why, one would naturally tend to go with the negative opinion in that circumstance.
But they wouldn't have to, would they? If the veteran had other evidence that would kind of help support his favorable doctor. I mean, there could be other things that fell into the picture or other evidence.
You're right. You're absolutely right. It's you're not compelled as the decision maker to favor one over the other. You're not compelled to agree with a medical opinion because it's provided from a VA source over a private source. It is an exercise of judgment.
That does make a lot of sense. Several years ago, matter of fact, the VA came out with a rule about post-traumatic stress disorder. And I think the rule stated that the veteran could not actually go outside the VA and get a medical opinion from an outside source unless that source is a treating physician. Is that still part of the game, or is that something? Has that changed?
Well, that rule was specifically under the revised criteria regarding the stressor. When VA changed the rule to allow a grant of service connection without proof of a stressor event, VA then relaxed the standard to use this fear of hostile action. And if it's just basically consistent with history and otherwise credible, VA can grant service connection for post-traumatic stress disorder without actually verifying the stressful event. VA limited that grant to only VA examiners.
So if you validate the stressful event, does that allow you to have an outside examiner for outside opinion?
Yes. If your stressor event is substantiated by evidence, VA is empowered to accept a medical opinion linking your diagnosis to that event from any competent medical source.
Okay. Makes sense. So as long as
there may be a few people. Yes, that might be confusing to some people because some of the early training didn't make that differentiation clear, and there was some confusion circulating about that early on.
All you PTSD folks, take heed to this. Listen to what this guy says. He knows what he's saying, so I don't want to post that on the side.
Thank you.
Get it annotated because that's good. I mean,
thank you. It's a nice compliment. Thanks.
We compliment you for good, and for bad, though. Of course, I think a person claim, your claim only has as much strength as your representation, and you need to have strong representation in order to get your claim, I think, settled through the VA. And the person that does your claim should have enough experience and knowledge and abilities to know, what you're claiming and how to do your claim. But I've seen so many claims that are done either at one of the posts or another place where alcohol is involved, and by the time you get done, you claim for PTSD, you're liable to walk out of there and claim for a broken foot. When you walk in with a swagger and out with a stagger, those joints. I've seen it. Believe me, I've seen it, and I've seen some crazy stuff in my day that way. And but fortunately, I've had enough education and knowledge to, being a home review employee myself, we can navigate the system. So,
it's complex. You need many shelves of books.
Yes. Many shelves of books.
Or many pages of
you need
text
to claim it's not
on your server.
That's true. And the more complex claim you got, the longer it's going to take you. Yeah. The more complex your claim is, the longer it's going to take.
That could be true, particularly if you are seeking many issues. I believe when last we saw it, I think each claim was averaging about 5 to 7 issues. And if you file a claim and you claim 20-some issues, that may result in some delay. And let me explain this. We all know that we have a great many veterans seeking benefits. It is therefore important for the decision makers at VA to move quickly on those claims. And so VA has certain production requirements for their employees to keep up with the pace. So if in the course of a day, the individual has 5 claims waiting for a decision, and 4 of them are 2 or 3 issues, and 1 of them is 20 issues, in most cases, what happens, the rater will work the 3 or 4 cases to meet their production and then begin work on the very complex one for part of the day. Then set that aside, and the next day work 2 or 3 claims that will help them reach their production, and then go back and start working on that 20-issue claim again. It's an efficient use of their time, and it's somewhat necessary because they have to maintain that production. And so the cases that are very large with many, many, many issues, the raters tend to take a nibble at it, a little nibble each day. And so as a result, that claim sits longer on average.
What would you do, Bill? Is that the way you do it?
That's the way most everyone would do it, yes. You know, if you were to sit on a 25-issue case and just work it until completion, it might take days. And then you would have to find a lot of simple cases to adjudicate very fast in order to catch up with your production requirements. So that's, you know, it's probably not in the individual's interest to claim quite so many issues. They certainly have the right, but recognize that could induce some delay.
So is 4 issues one patient case? Or how is that? Is it ratio, right? Something like that.
Thank you all for listening. That ends this show. And now I'm going to zoom off.